Guys, welcome back. And today we will see the nursing diagnosis and care plan for anxiety disorder. So, first of all, we will see what is anxiety. What is anxiety? It is a fear or it is an anticipation of fear. So, what is fear? Fear is a natural thing, it is an automatic reaction to real or immediate danger. It triggers the flight or fight response. So, anxiety is related to fear but focus on future threats. It's the body's and mind's preparation for something that might happen. Anxiety includes thoughts, emotions, physical reaction, and behaviors aimed at avoiding or handling perceived danger. So, what is anxiety disorder? Anxiety disorders are the most common psychiatric condition affecting 18% of the US adults, about 40 million people. They often occur alongside depression, alcohol, and drug abuse. Anxiety can affect anyone regardless of background or health. People experience it differently, often caused by fear, uncertainty, overthinking, and avoidance. It can impair daily functioning and may lead to substance abuse or personality issues. So it is the most common psychiatric condition and it often occurs alongside depression, alcohol, and substance abuse. Now we will see the nursing diagnosis and care plan for anxiety disorder. So in priority base, first one, anxiety related to perceived threat or stressor, as evidenced by restlessness, increased heart rate, sweating, verbalization of worry. Second one is ineffective coping related to inadequate stress management skills as evidenced by inability to meet role expectations, substance abuse, and avoidance behavior. Third one is disturbed sleep pattern related to excessive worrying or racing thoughts as evidenced by difficulty falling or staying asleep, fatigue, and irritability. Fourth one, powerlessness related to lack of control over anxiety symptoms or stressors as evidenced by verbal expressions of helplessness, withdrawal, decreased decision making. And the last one is social isolation related to fear of judgment but panic attack in social setting as evidenced by avoiding social interactions, limited communication and feeling of loneliness. So these are all the nursing diagnoses we can write for anxiety disorder based on the priority. They are anxiety, ineffective coping, disturbed sleep pattern, powerlessness, and social isolation. Now we will see the nursing care plan. Here first we will see the nursing care plan for anxiety related to perceived threat or stressor as evidenced by restlessness, increased heart rate, sweating, verbalization of worry. The subjective data always the patient says that she or he is tired and anxious. So as I said in previous videos, while creating your nursing care plan, write the columns like this: assessment, diagnosis, planning, rational, implementation, and evaluation. In the first column, we will write subjective data and objective data. Subjective data means what the patient says about the condition. Objective data means what you feel about the situation of the patient. Then subjective data, the patient says that he or she is tired and anxious. Objective data, that means what you have observed. The patient looks dull and tired. In next column, we will write the diagnosis first and also we'll write the goal. So the diagnosis is anxiety related to perceived threat or stressor as evidenced by restlessness, increased heart rate and sweating. And the goal will be the patient will demonstrate reduced anxiety as evidenced by decreased restlessness and verbal reports of feeling calmer within 48 hours. So you have to plan a goal. So always will be in future tense. The patient will demonstrate. Okay. Then while coming to the planning column, you have to write in present tense, assess the general condition of the patient, do history collection and physical examination. And what is the rationale? To understand the general condition of the patient. And implementation column, if you have done, you can write done history collection and physical examination. Second one, conduct mental status examination. For what? To know the mental state and orientation of the patient. In implementation column, completed mental status examination. Next one, establish a calm and safe environment. For what? To increase level of comfort and prevent hazardous. Then implementation, established or provided a safe environment and started observing the client. Next one, encourage the verbalization of the feeling and fears. For what? To explore the feeling and problems of the patient. In implementation column, encourage the patient to talk and started to collect the history. Next one, teach relaxation techniques like deep breathing exercise. For what? To reduce the anxiety and deviate the mind. And in implementation, you can write past tense, taught different relaxation techniques and breathing exercise. Next to planning is monitor vital signs to assess the anxiety level. For what? To check the variation in the heart rate and pulse. And in implementation, you can write started monitoring the vital signs. And last one is provide therapy and support as per the doctor's order. For what? What is the rationale? To improve the condition of the patient. And in implementation column, past tense, performed supporting services. And in evaluation column, again the past tense you have to write the patient demonstrated reduced anxiety as evidenced by decreased restlessness and verbal reports of feeling calmer within 48 hours. So this is the first nursing care plan. Second one is ineffective coping. Subjective data, the patient says he or she is tired and feeling isolated. Objective data, the patient looks irritated with less eye contact and hyperactivity. Diagnosis, again the same thing, ineffective coping related to inadequate stress management skill as evidenced by inability to meet role expectations, avoidance, behavior, and substance use. Goal, the patient will identify at least 2 effective coping strategies and demonstrate their use within 1 week. You can plan based on the situation of the patient. Then in planning column, do history collection and physical examination. For what? To understand the general condition of the patient. Done history collection and physical examination in implementation column. Then assess the current coping mechanism of the patient. Rational awareness of coping mechanism will allow to tailor intervention or plan intervention. In implementation, assessed the coping mechanism. Then in planning column again, provide education on healthy coping like exercises. Healthy coping strategies will help to prevent the maladaptive behavior. Then in implementation provided health education on exercises and writing other coping mechanisms and small steps to follow. Then refer to counseling or support groups. What is the rationale? Professional support aids in skill development. Implementation, refer the patient to support group. And the last planning for this nursing diagnosis is encourage small manageable tasks to improve self-efficacy. For what? To achieve small goals improves confidence. Encouraged and started to perform small activities to enhance confidence. And the evaluation you can write, the patient identified techniques for effective coping strategies and demonstrated their use. Next, nursing diagnosis for disturbed sleep pattern. The patient complains that he or she is unable to sleep. That is subjective data. The objective data, the patient looks very dull and showed irritability and increased vital signs. Diagnosis, again the same thing you can write. Disturbed sleep pattern related to excessive worrying or racing thoughts as evidenced by difficulty falling or staying asleep, fatigue and irritability. And the goal, the patient will report improved sleep quality and increased rest period within 3 days. Again, planning rational implementation, assess sleep pattern to identify the issues to help to target intervention, assessed the sleep pattern and recorded. Do history collection to understand the general condition of the patient. Done history collection. Do mental status examination to understand the mental state of the patient. Done mental status examination. Encourage the bedtime routine with relaxation activities to promote sleep. Encouraged proper bedtime routine. Limit caffeine and stimulating activities before bedtime to reduce the stimulants, improve sleeps quality. Reduced stimulants such as coffee before bed. Use of sleep hygiene education. Sleep hygiene reduces insomnia. Educated about sleep hygiene. And in evaluation column, you can write the patient reported improved sleep quality and increased rest periods within 3 days. If you plan accordingly, if you implement it, definitely the patient will report good quality in sleep. Then the next one is powerlessness. Subjective data, the patient says he or she is feeling helplessness and hopelessness always. Objective data, the patient shows decreased confidence while talking and less interested to communicate. Then again, diagnosis, powerlessness related to lack of control over anxiety symptoms or stresses as evidenced by verbal expression of helplessness, decreased decision making. And the goal, the patient will verbalize feeling of control and participate in decision making care plan. Again, in planning, rational and implementation, encourage the patient to participate in decision-making process to enhance the sense of control. Encourage the patient to participate in communication. Do mental status examination to know the general condition of the patient. Done mental status examination. Provide clear and consistent information about condition and treatment to reduce the uncertainty. Provided clear information about treatment. Set achievable goals with patients, communication, and collaboration. Realistic goals will enhance the confidence of the patient. Started actions based on goals. That's the implementation. Then reinforce the patient's strength and past success. Reinforcement promote self-esteem. In implementation, you can write provided psychological support to enhance the confidence of the patient. And in evaluation, you can write patient verbalized feeling of control and participated in decision making in care plan. And one more, nursing diagnosis, social isolation. Subjective data. The patient says that he or she feels panic attack in crowd and feeling scared. Objective data, the patient looks very panicked, tired, and maintain less interaction with others. The diagnosis is same, social isolation related to fear of judgment settings as evidenced by avoiding social interactions and limited communication. The goal, the patient will encourage in at least one social interaction daily and express decreased feeling of loneliness within 1 week. You can plan again, depend upon the condition of your patient. And while coming to planning, do history collection to understand the general condition of the patient, done history collection, do mental status examination to understand the condition of the patient, done mental status examination, assess social support and barriers to identify the support helps in planning, assess the social support barriers such as family and friends, encourage exposure to social situation, gradual exposure reduces the avoidance behavior, encourage to join in small meeting, facilitate group therapy to improve socialization, started group therapies, teach communication skill, it will improve confidence, started teaching communication skill. And in evaluation, you can write the patient encouraged in one social interaction daily and expressed decreased feeling of loneliness within 1 week. These plans you can change depend upon the condition of the patient, but you have to follow this format while writing. Hope you understand, guys. So this is about the nursing diagnosis and care plan for anxiety disorder. We'll come with other nursing diagnosis and care plan next week.